You ever experience dry, painful, cracked corners of your mouth? So painful that sometimes when you wake up in the morning and you go to yawn or just open your mouth, it almost feels like your mouth is cracking open. This can be really painful, sore, and uncomfortable and stay with you through the day, where it can actually burn or sting when you're trying to eat foods or brush your teeth. Anything that actually gets into some of those open cracks along the corners of the mouth can sting or burn. My name is Dr. Aram Elias. I'm a board certified dermatologist. I've been in practice for over 20 years, and I love sharing my insight into seeing thousands and thousands of patients every year. So follow along, subscribe now, and let's talk about a condition called angular cheilitis or Perleche, which is another name for this condition. Perleche or angular cheilitis is the medical terminology for the condition where people start to experience dry, cracked corners of their mouth that become painful, sore, and inflamed. What this condition actually is the form of a yeast infection along the corners of the mouth. So who's at risk for developing this condition? The most common scenario that I come across for patients that develop this would be people that tend to be mouth breathers at night. So you're breathing through your mouth for a prolonged period of time. There could be some saliva that actually builds up along the corners of your mouth that then breaks down or macerates that skin. Ultimately, then yeast from inside of our mouth can come out and inflame that skin, and that's what makes it spiral out of control. People that wear mouth guards at night, dentures, have braces, sometimes it's medications we're on, such as Accutane, which is a common one I prescribe for acne. A lot of times these patients have such dry skin that it can also cause the same condition. The other group of patients to think about are those with allergies or allergy prone. They might be more mouth breathers at night only because of nasal congestion, as well as people with a high sugar diet, only because if you have lots of sugar in your diet, then you are going to make the environment of your mouth more prone to yeast overgrowth. Understanding Perleche is absolutely essential because there are 2 or 3 key components to what makes up this condition, which plays a role not only in treating it, but we have to prevent it, because if you're not on top of preventing it, you're just going to keep getting it back again. So we need to make sure you understand why it happens and then the steps you need to do to prevent it. So first things first, if you've already experienced this condition, then let's talk about ways that we tend to actively manage it. We need to actually address both components of what's going on there. To actively treat Perleche, you often have to see your dermatologist, because we need to consider using anti-inflammatories and sometimes steroid creams to calm down the inflammatory component of what you're experiencing. And that's what addresses the symptom component of this, the painful, sore redness. The actual yeast component, we often have to prescribe a topical anti-yeast agent along with the anti-inflammatory agent to address both aspects. I tend to describe it as treating both the cause and the symptom, because if you just treat the yeast, you may still have the symptoms left over from the prior inflammatory reaction. So we need to make sure we cover both of our bases. If we don't, one aspect is still left behind. If you just use a steroid product, then you might find that it calms it but doesn't get rid of it, and it keeps coming back again and again. And if we just use an anti-yeast agent, the inflammation is still there, so people symptomatically still feel uncomfortable. So we need to do both simultaneously to get the best results. The other component of this is understanding why it happens. So if you're breathing through your mouth, especially at night or even during the course of the day, especially if you're in a hot, humid environment, then you will actually find that that moisture that builds up along the corners of the mouth is partially responsible for this. That moisture needs to be addressed in the sense that I can't necessarily tell you to start breathing through your nose. That wouldn't be very fair to say, but what we can do is protect those corners of your mouth when you are in circumstances where you might be more prone to this. So if you are wearing a mouth guard at night, if you are taking Accutane and you're trying to treat your acne, or even using topical acne products, because even those can sometimes accumulate along the corners of the mouth and break the skin down. If you wear dentures, or you have a high sugar diet, or you feel like you're just very prone to getting this condition, it's important to create a barrier to protect those corners of your mouth while you're sleeping at night. By doing so, then the saliva will go on top of the barrier and not onto your skin directly, and be less likely to break it down so easily. So this would be things like applying simply Vaseline or Aquaphor, or even diaper rash creams, things like Desitin, as a simple barrier along the corners of your mouth every night before you go to bed, to be one step ahead of it. If you can do that, then you're going to be less prone to this condition over time.